Pain management is all over the headlines, due in part to the growing opioid addiction crisis. But managing pain does not have to involve addictive drugs. Dr. Lindsay Jobe is an interventional pain specialist on the Suncoast, and she is here to talk about alternative treatments. Welcome, Dr. Jobe.
Thank you. Thanks so much for having me.
So what do you tell people who are actually hesitant to go to the doctor and get help with their pain because they're afraid they're going to end up on some drug they're going to get addicted to?
Well, you know, I was really sort of baffled when I moved here from Chicago 3 years ago. And, you know, patients would come to my clinic scared to death that I was going to give them pain medication. And I'm really trying to sort of change that culture with Restore for patients to come in and understand that we're not trying to give pain medication. Our goal is to make patients feel better, and we can do that through, you know, interventional techniques and injections and procedures that actually take the pain away, you know, so that you don't get, you know, stuck on these medicines with terrible side effects and, you know, that make you just feel cruddy.
Yeah, and go ahead, Linda.
Well, I need knee replacements. Can you still go through things like that and not have the pain, or does giving up these opioid drugs mean that we're going to have more pain?
The technology that is out there now is incredible, and I think we're going to talk a little bit today about, we just purchased a partnership with the Venice Regional Health Park. We purchased a machine, it's called the CoolLeaf machine, and we can actually use this machine to burn nerves deep inside to resolve knee pain with even sometimes without surgery, and certainly without narcotic medications.
Well, since you've mentioned CoolLeaf, let's talk about that more in depth, and then we can talk about the other alternatives as well.
Yeah.
So, CoolLeaf is doing what? We're looking at a picture here of the anatomy of a hip and knee. What does it specifically do?
So what we're looking at doing is I tell my patients, you know, it's a big term. We're burning nerves, but we're not burning big nerves that give us the ability to move or to feel sensation. We're burning small nerves that all they do are carry pain sensations. So we don't need these nerves to go on about our daily lives.
So you're taking away the ability to feel the pain, but not any of the motion of the movement. Linda, this sounds like exactly something someone like you would be up to.
Yes. Exactly.
So that's so hopeful.
CoolLeaf is one alternative to help control pain. What are some of the other alternatives that you use in your practice?
So you know, I tell my patients that I'm like a mechanic. I've got a belt full of tools, you know, and so we keep fighting for the patient. You know, if something doesn't work, we don't stop fighting for them. And opioid medications that's the absolute last alternative that we can use. So we can do epidural steroid injections, we can burn nerves, we can numb nerves. There's so many amazing things that we can do other than use opioid medications.
Are there medications that still work, at least to some extent, but are safe?
They all have side effects. So, you know, our goal at Restore is to really restore you to your function without any medicine. We don't, you know, even ibuprofen has side effects. You know, it can, you know, give you, you know, upset stomach and it can damage your kidney. So everything has side effects. So, you know, when my patients come in and they meet with me, they're always like, "You're not going to give me any pain medication, are you?" And I smile. I'm like, "No, this is, you know, I spent 13 years going to school so that I can, you know, be the intermediary between the primary care doctor and the surgeon. I want to keep you from having surgery as long as I possibly can." Yeah,
and keep you from addictive drugs, because we've ended up in such a bad place culture-wise, but yet who wants to be in pain?
Yeah. Absolutely.
I love this.
No, great attitude. I love the
Yeah.
culture. So for more information, you can visit RestoreMedicalPartners.com. Coming up next, get ready. We've got cute and cuddly puppies, and they are looking for a home.